Hi friends, I am presenting a case of hysteroscopic removal of retained products of conception. A multiparous who had underwent medical method of termination of pregnancy 1 month back complained of persistent bleeding and a low backache. Ultrasonography was showing a retained products of conception of 3 into 2 centimeter, but there was no vascularity, that is Gutenberg classification type 0 it was coming. Hysteroscopy was performed and and diagnostic we can see there are some amount of products of conception still present even 1 month after the termination of pregnancy. She was having a persistent recurrent vaginal bleeding with a low backache. So cold resectoscope without activating the energy using the loop is a very good method of dislodging all the products of conception under vision with a very minimal amount of damage to the endometrium, and which further reduces the chances of Asherman syndrome, which is a very frequent complication of RPOC removal by DNC. Under vision, removal of all these products of conception, it assures that all the products of conception have been completely removed and also reduce the chances of endometrial damage, which can lead to Asherman syndrome. So, cold loop is used without activation of energy and they are very easy to dislodge. So it depends upon, sometimes if they are vascular, only then we may have to activate only at the site of vascularity, and otherwise gentle dislodgement with a cold life is sufficient to completely evacuate all the products of conception. So they are very easily dislodgeable, and we can see most amount of adhesion was present in the posterior wall of the uterus than to the anterior wall of the uterus. Anterior wall adhesions were very easily re removed when compared to the removal of the adhesions of the rods of conception to the posterior wall. Maybe they were arising from posterior wall, or they were getting some amount of vascularity which was very minimal amount, which was not demonstrable by ultrasonography. So this is a complete removal of all the products of conception under vision, and later we did a check examination after removing it. So we can see now the uterine cavity is completely clean, and there is no any evidence of damage to the endometrium, completely safe. Thanks for watching this video.